Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our update on the pandemic. So the story continues that we were discussing last week, and that is that the Omicron variant is incredibly highly contagious. Test positivity rates in the state of Maryland are now up to 27%. We now have over 3,000 Maryland residents in Maryland hospitals, 499 of those in intensive care. Now, that's a lot of people that are very sick, but I need to point out to you that on a percentage basis, it's a lower percentage of people sick enough to make the ICU than we've seen in previous peaks. And that is because the Omicron variant, even though it's much more highly contagious, is not making people on average as sick as previous variants. So if there is some good news here, that's part of it. At GBMC right now, we have 88 patients who are COVID-19 positive. Now, some of those are in the emergency department, and we also have a new phenomenon that 13 of those are in labor and delivery or postpartum. Some time ago, we started testing all women coming in to deliver a baby. And now, because the Omicron variant is so contagious, many women are coming in without symptoms of COVID, but they are testing positive for the variant. Of the 88 patients in GBMC right now, 12 of them are in the intensive care unit. And once again, I have to tell you, 0 of those 12 people have been immunized. People who are not getting vaccinated are putting themselves and all the people they run into at risk. Please get immunized. In the rest of the hospital, we do have some people who have been immunized and are now sick enough to be in the hospital with COVID, but those are uniformly very frail elders or people with chronic disease. Now, there's a hidden issue here, and that is because most healthy adults are not going to get very sick with the virus, it's giving them the message that maybe they don't need to be vaccinated. I would ask those people to think again. Even if the probability that you won't get very sick with the virus is high, think about the people who you could transmit the virus to. Think about your own loved ones. Think about your frail grandmother, for example, and please do the right thing and get immunized. The evidence is absolutely clear. You are putting yourself and others at risk if you do not get vaccinated. Thank you for listening to that message. Now, we want to talk a bit about yesterday's news conference with the governor, where he made some significant changes. He declared a state of emergency, which gives new powers to the state's Secretary of Health to oversee hospitals to assure that they are working together to help Maryland residents. We will now have 1,000 Maryland National Guardsmen who will be coming to assist with things like transportation of patients from one hospital to another or from hospitals to extended care facilities, and also to set up a number of new testing sites. While I'm talking about testing, over the last 2 weeks, once again, GBMC has set up 3 separate mechanisms for testing people for COVID. And we have seen people presenting to the emergency department just to be tested. We have seen that number go down, and I want to thank the community for that. If you are looking to be COVID tested and you are one of our primary care patients, please go into your My Chart and you can schedule a COVID test for yourself if you need it. If you are not one of our primary care patients, you can go to www.gbmc.org and find the site for scheduling a COVID test, and we will accommodate you as well. Again, please do not go to the emergency department. Please do not go to any emergency department just to be tested for COVID. The emergency department is there to help very sick people. Thank you very much. Please be patient with healthcare providers. Everyone is under stress. Our people are working many hours to do the right thing and help people. But sometimes there are queues, there are lines, there's waiting that is happening that may not be a typical situation. Please be understanding if you need to wait, and please be patient with the staff. So another thing I'd like to highlight is our people are always pumped up. They're grateful when people reach out to recognize them. If you would like to leave a message for a healthcare provider, you can go to www.gbmc.org and leave a message of gratitude. That goes a long way, and thank you. So in closing, I would like to remind you once again, please get vaccinated, wear your mask, stay socially distant, and wash your hands. If you need us, we are here for you, but don't let your guard down. Do all the right things and be safe. Thank you very much.